The first trial of citywide coronavirus testing began in Liverpool today. Over the next fortnight, anyone who lives or works in the city, regardless of whether they have symptoms, is eligible for a test. The pilot aims to see how widespread the virus is, and it's hoped it could lead to mass testing in other towns and cities. Our health correspondent Dominic Hughes has spent the day in Liverpool.
Is this the way out of Liverpool's COVID dilemma? Mass testing has begun in the city that's seen some of the highest infection rates in the UK.
It's a bit of an inconvenience, but at the end of the day, if that means you can spend your Christmas with your grandparents, why wouldn't you?
You haven't got any symptoms, right?
No, asymptomatic. It's just because I feel like the more people get tested, the sooner we can get out of this, get over with and try and get back to normality, really.
Already a significant queue is built up here at one of the testing centres in Liverpool. None of these people have any symptoms. Many of them haven't even been tested before. But that's the point of this pilot, to try and identify people who are asymptomatic, who don't have any symptoms and yet still may be infectious.
The latest data shows that infections across the UK are still rising, but the rate of increase has slowed. And while this pilot may only last 10 days, a shorter trial than was expected, officials believe it will deliver valuable lessons for other towns and cities.
It is absolutely essential in rolling out testing for the future across the whole country, and in the absence of a vaccine, until we've got a vaccine, we have to live with COVID. COVID hasn't gone anywhere. We have to live with COVID. So having that mass testing approach where communities understand where the virus is, who's got it and what they need to do will be incredibly helpful for helping us all live with COVID.
2,000 members of the armed forces are supporting the Liverpool pilot. Some residents will get a faster procedure known as a lateral flow test that can give results in around 20 minutes. A positive result by this method will be double-checked with a regular swab test. And this approach, testing entire cities, has helped other countries to curb infections. But community support is vital.
We need buy-in by the population. The population need to have trust in the government and local government that this is going to work, that the sacrifice they're going to make in going for testing and the time it takes will be worth it, that there is a value in doing this.
The logistical challenge of repeatedly testing nearly 500,000 people is formidable. There were some long queues today, but more test centres are opening tomorrow. The real value of the pilot, though, will only become clear over the next few weeks. Dominic Hughes, BBC News, Liverpool.
Well, let's look now at the latest government figures. There were 23,287 new coronavirus infections recorded in the latest 24-hour period. The average number of new cases reported per day in the last week is now 22,392. 1,463 people had been admitted to hospital on average each day over the week to last Friday. 355 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. It means, on average, in the past week, 321 deaths were announced every day, and it takes the total number of deaths so far across the UK to 48,475. Well, new figures from the Office for National Statistics suggest that the rate of coronavirus infections across England and Wales appears to be slowing down. But in the last week of October, more than 600,000 people in England had the virus. Our science correspondent Rebecca Morell is here. You've been looking at the figures. What do they show?
Well, these numbers really do give us a weekly snapshot of where we are with the pandemic, and they're based on a survey of households chosen at random from across the UK. So this graph actually shows the estimated percentage of people with the virus in England, and you can see how the cases are really rising at the end of September, but they are starting to level off, and this suggests that the regional restrictions that were introduced a few weeks ago may be starting to have an impact, although the numbers aren't going down. And it's a pattern that's being repeated across the UK, but there are differences in the prevalence of the virus too. So in Northern Ireland, that's got the highest infection level, with 1 in 75 people estimated to have the virus. In England, it's 1 in 90 people, and in Wales and Scotland, it's 1 in 110 people. The R number has also been published today in this slew of data, and this basically gives you an idea of how much the virus is spreading. And the estimate is between 1.1 and 1.3, the same as last week. But because it's above 1, that does suggest the pandemic is still growing. Now, we have got tougher restrictions, you know, the lockdown in England. But the issue is, if you want to get cases down quickly, you really need to get that R number well below 1. And the question is, with places like schools and universities open at the moment, whether these measures will really do that.
Rebecca, thank you.